Hello, and thank you for your interest in the Sarcopenia Quality of Life questionnaire. In this video, we'll briefly present the questionnaire and the most important information to know about it. The name SarQoL stands for Sarcopenia Quality of Life questionnaire. It is a patient-reported, auto-administered outcome measure that evaluates quality of life. It has been specifically designed with and for sarcopenic community-dwelling older people. There are a total of 55 items in the questionnaire, which are categorized into 7 domains of health-related dysfunction. Consequently, there are also 7 domain scores and an additional overall quality of life score. The questionnaire was developed in 2015 using a rigorous item generation and item reduction process, shown in the flowchart on the right. And this is the end result. 55 items were selected from 7 domains of health-related dysfunction, namely physical and mental health, locomotion, body composition, functionality, activities of daily living, leisure activities, and fears. Since its development, we have pushed to make the SarQoL available in as much languages as possible, and we currently have 33 local versions published on the website. A big thanks goes out to all the translators who have been instrumental in this effort. The measurement properties of the questionnaire have been demonstrated in 17 publications. We have found that the SarQoL questionnaire can discriminate between sarcopenic and non-sarcopenic participants. Most studies have used the EWG-SOP criteria, but there are also validations available with the revised EWG-SOP2 criteria, as well as with the SarQF questionnaire. Internal consistency has always been high, with a slight risk for redundancy. In terms of construct validity, we've looked at hypotheses on the expected correlations between similar or completely different domains from other questionnaires. We've consistently found good convergent validity and average divergent validity. On the whole, the SarQoL is considered to have good construct validity. Test-retest reliability has been evaluated in 13 cohorts, and the lowest intra-class correlation coefficient found was 0.91, indicating a very high reliability. At a certain moment, we pooled the test-retest reliability data from 8 cohorts and obtained a sample of 318 sarcopenic people. In this sample, we found a standard error of measurement of 2.65 points, which leads to a smallest detectable change of 7.35 points. We've never found that more than 15% of participants had either the lowest or the highest overall quality of life score, so there are no floor or ceiling effects. Lastly, we have carried out an analysis on the ability of the SarQoL questionnaire to detect change over time. We had a sample of 42 sarcopenic subjects, which we followed over 2 years. We found good responsiveness through hypothesis testing and with high effect sizes. Recently, we have developed and validated a shorter version of the SarQoL questionnaire, reducing its length from 55 to 14 items. We've examined the measurement properties of this short form in a sample of 214 older people from Belgium. The developments and the results from the validation study have been published in March 2021 and show that the short form SarQoL questionnaire can discriminate between sarcopenic and non-sarcopenic people. The SF SarQoL is highly internally consistent, and the correlation between the score of the short form and the original SarQoL questionnaire is very strong. The same is true for the correlations between the short form and the EQ5D and its visual analog scale. We found excellent test-retest reliability, but the fit indicators for a unidimensional model evaluated through confirmatory factor analyses were borderline. Thank you again for your interest. If you have any questions or remarks, you can get in touch with us by sending a mail to info@sarqol.org. You can visit our website on www.sarqol.org, where you can find publications and the different versions of the questionnaire. And we are also present on Facebook with the handle @SarQoL. Thank you.